Good afternoon, class. This is Dr. Gasco, and we're going to have a lecture on neuroanatomy this afternoon. The topic of our lecture is cranial fossae and its contents, meninges, and venous sinuses. Okay, so first we'll take up the cranial fossae found at the base of the skull. Okay. Now, this is the base of the skull, as seen in its internal surface, and you have here the three cranial fossae. This is the area here. This is called the anterior cranial fossa. This area here is called the middle cranial fossa, and here at the back, this is the so-called posterior cranial fossa. Okay, so we'll take up first the bones of the anterior cranial fossa. Okay, so this is the anterior cranial fossa, and the part of the brain that is lodged is the frontal lobe. And what are the structures composing the floor? The floor is primarily formed by the orbital plate of the frontal bone. This orbital plate of the frontal bone forms the floor, as well as the roof of the orbit. It also forms a big part of the roof of the orbit. Okay, so this is the cribriform. This is the orbital plate. Now, at the middle, you'll have this bony structure. We'll take up first this bone, by the way, is the a part not of frontal bone, but of ethmoid bone. Ethmoid bone. Now, ethmoid bone is one of the cranial bone. Okay, the part of the ethmoid bone that can be seen in the anterior cranial fossa are the following. First, this one here at the side is called cribriform plate. Cribriform plate. Okay, as the name implies, cribriform, you will find numerous openings in the bone, in new openings in the bone. Now, this cribriform plate, part of the ethmoid bone, forms the roof, part of the roof of the nose. And the structure that is lodged here is called the olfactory bulb. Okay, and the openings that can be seen here are parts of the olfactory phyla, or singular phylum, olfactory phyla, meaning to say these are the filaments that passes through the numerous openings. Okay, so olfactory bulbs lodged here with the olfactory phyla passing through the numerous openings. Then at the center, the middle, you have this crista galli. Okay, this part of the bone will serve as the attachment of the anterior end of falx cerebri. Okay, falx cerebri we will discuss later on. This is part of the Dura Mater. So it is attached here, as well as a bone here on the anterior to crista galli. There is another bone that projects. This is called the frontal crest. Frontal is part of the frontal bone. So these two bones, frontal crest and crista galli, will serve as the anterior attachment of falx cerebri. Okay. Now, what structure serves as the boundary between the anterior cranial fossa and the middle. This is the middle cranial fossa. The bone that separates, that serves as the boundary, is this small bone here. This is called the lesser wing of the sphenoid bone. The lesser wing of the sphenoid. Now, the sphenoid bone is another cranial bone, and it is divided. It has a flying butt appearance. So you can see here. Try to picture this structure here. This is the lesser wing of the sphenoid bone. This is the body of the sphenoid bone, and this is the greater wing. This is the greater wing of the sphenoid bone. Greater wing of the sphenoid bone. So the lesser wing of the sphenoid bone serves as the boundary between the anterior cranial fossa and the middle cranial fossa. And you have here in the a part of the lesser wing, the so-called anterior clinoid process. Anterior clinoid process will serve as the attachment of the free border of tentorium cerebelli. Tentorium cerebelli, which we will discuss later on. Okay, so that is the boundary. Now we'll go next to the middle cranial fossa. This is the middle cranial fossa, and the floor is formed primarily by the greater wing of the sphenoid bone. Take note again that the sphenoid bone has a flying butt appearance, paniki. So this is the lesser wing, this is the greater wing, which serves as the floor. So this is the middle cranial fossa, and the structure that is lodged here is the temporal lobe of the brain. Okay, so you have numerous openings or structures found here. So I will be mentioning the openings we call foramina, and I will hold you responsible to know what are the structures that passes through these different foramina. Okay, one, you have here the optic canal. Okay, then what structure passes through the optic canal? Then you have this one here. This is a chiasmatic sulcus. Okay. Then you have another big opening here, which is called the greater orbital fissure. There are numerous structures that will pass through the greater orbital fissure. You should know what all the structure that passes through the greater orbital fissure. Okay. Then this is the body. This is the body of the sphenoid bone. You have structures like tuberculum sella. Then you have dorsum sella. In between the two, you have here a concavity. This concavity is called sella torsica. Now, why is this important? Sella torsica is the site where the pituitary gland is lodged. Pituitary gland of the hypothalamus. Again, pituitary gland is part of the hypothalamus, and it's lodged here in the sella torsica. Okay. Now, so this is the body, contains the sella torsica, and inside also the body you have there an opening, a cavity, which we call the sphenoidal paranasal sinus. So the sphenoidal paranasal sinus is found here in the body of the sphenoid bone. Okay, now going laterally, you have numerous opening. You have here foramen rotundum. You have foramen ovale. You have foramen lacerum. Now the best way to study this one is to have a skull. These are you have here the skull, and you have here the opening. Probably you can visualize, okay, what I have mentioned. Probably I'll just recapitulate what I have mentioned. This is again orbital plate. This is the crista galli. This one is the cribriform plate. Okay, this is the frontal crest. There is an opening here. This is the frontal paranasal sinus. frontal paranasal sinus. Okay, so this is the lesser wing of the sphenoid bone. This is the anterior clinoid process. This is the sulcus chiasmaticus or chiasmatic sulcus. This is the optic canal. This is the superior orbital fissure. This is superior orbital fissure. This is foramen rotundum, foramen ovale, foramen lacerum, foramen spinosum. Now, this foramen spinosum is important. Why? This is where the middle meningeal artery. The middle meningeal artery is the primary blood supply to the meninges. The middle meningeal artery. So it will pass through this opening here called foramen spinosum. The middle meningeal artery is a branch of the mandibular, branch of the maxillary artery. I mean, it's a branch of the maxillary artery, and after passing through the foramen spinosum, it will divide into an anterior branch and a posterior branch. So you have here a groove for the anterior branch. Okay, so take note. Then you have here the foramen lacerum. Okay, foramen lacerum. So again, I will hold you responsible on the structures that will pass through these different foramina. This is the sila torsica. This is the sila torsica. Take note, you have here an opening, a buho. This is the opening here is I am pointing into the sphenoidal paranasal sinuses. Inside is the sphenoidal paranasal sinuses. Okay, so this is not a normal anatomy because there is no opening. Normally, there is no opening here. Nabuhola niya. Nabuhola. So this is closed, and this is what we call the sila torsica. Okay, so what are the structure that is large? Again, is the what we call the temporal lobe. Okay, so those are the important structures found in the middle cranial fossa. By the way, if you compare the three, which has numerous, which foramina has, which cranial fossa has numerous openings, it is the middle cranial fossa. That is why among the three, the weakest is the middle because of the numerous openings. Okay, now we proceed to the posterior cranial fossa. This is the posterior cranial fossa here. Maybe we can use this one again. This is the posterior cranial fossa. And what is lodged in the posterior cranial fossa? You have the brainstem. Brainstem. When we say brainstem, we refer to from down upward, the medulla oblongata. You have the pons and the midbrain. The midbrain. Okay, and you have here the greatest opening in the skull, the foramen magnum. Foramen, where the medulla oblongata will pass through. Okay, and this foramen magnum also serves as the boundary between medulla oblongata and the spinal cord. So above the foramen magnum is medulla oblongata. Below foramen magnum is the spinal cord. So aside from the medulla oblongata, you have numerous structures that will pass through to the foramen magnum. Okay, so and I will hold you responsible on the structures passing through the foramen magnum. Now, what bone serves as the boundary between the middle cranial fossa and the posterior cranial fossa? This bone here is looked like a rock, so it's called the Petrus bone. You say Peter means rock, and the Petrus bone is part of the temporal bone. Temporal bone. So this Petrus bone has numerous cavities inside, which we call the labyrinth. So, what is the important structures found inside the labyrinth, or the numerous cavities found inside the Petrus bone? you have the apparatus for hearing and equilibrium. The apparatus for hearing and equilibrium are found inside the labyrinth of the Petrus bone. Okay, and the Petrus bone has numerous sinus groove. Okay, for example, here you have the groove for the superior petrosal sinus. Okay, and then you have here also the arcuate eminence. Arcuate eminence is the impression caused by the superior semicircular canal. Superior semicircular canal, the arcuate eminence. What else? You have here the hiatus or groove for the greater petrosal nerve. Greater petrosal nerve. So, foramina. What are the important foramina found or opening? You have here the internal acoustic meatus. Internal acoustic meatus or internal auditory meatus. Okay, take note, you have internal acoustic, you have also external. So, okay, external acoustic meatus is part of the external ear. You know, the ear is divided into external, middle, and inner ear. And the external acoustic meatus is part of the external ear. While this one is an opening. Internal acoustic meatus is an opening or foramina that goes inside the numerous cavities. What are the important structures that will pass through? Again, I will hold you responsible for that. Then you have here another important structure found in the boundary between the Petrus bone and the condylar part of the occipital condyle. You have this jugular foramen. Jugular foramen. Okay? Now, this jugular foramen is important foramina because it is where this sinus here, you have here a big sinus. We call this the sigmoid sinus, venous sinus. So what passes through the sinus, sigmoid sinus, is the venous blood. This will drain into this jugular foramen. Jugular foramen. Okay? So the jugular foramen will be divided into anterior two compartments. The posterior compartment here is for the passage of the sigmoid sinus, the blood, venous blood from the sigmoid sinus that will be continued downward as the internal jugular vein. So the internal jugular vein is the continuation of the sigmoid sinus. So here, which is in the posterior compartment of the jugular foramen. How about in the anterior compartment here? You have here anterior compartment. Cranial nerves. Cranial nerves will pass through in the anterior compartment. Cranial nerve number 9, 10, and 11. 9, 10, and 11 will pass through the anterior compartment of the jugular foramen. So you have here the numerous sinuses, venous sinuses here. This is this groove for the sigmoid sinus, groove for the transverse sinus, groove for the transverse sinus, and then you have this internal occipital protuberance. This corresponds to the site of the confluence of venous sinuses. Confluence of the venous sinuses. Okay, so this is the groove of this the left transverse, this is the right transverse sinus, continued to sigmoid sinus into the jugular foramen. So these are the sinuses groove, which you can see. Okay, so what are the other parts? This is the basilar part. The posterior cranial fossa is primarily formed by the occipital bone. Occipital bone. Okay. So those are the important structures found in the posterior cranial fossa. Again, very important for you to take note on the structures that will pass through the different foramina. Okay. Next, we'll proceed to the meninges. Okay, meninges. Ginapala. you have here this picture of the coverings of the central nervous system. Of course, the outermost and the toughest and the thickest is the Dura Mater. The Dura Mater. Okay? Then after the Dura Mater is the Arachnoid Mater. Arachnoid Mater. This one here, this is the Arachnoid Mater. This is the Dura, the outermost, the thickest. This is the Arachnoid Mater. And then you have the innermost, the thinnest and vascular is called the Pia Mater. So this is the coverings we can see in the brain, in the cerebrum. You can also see here in the covering the spinal cord. So the outermost is the Dura Mater, which also provides covering to the outgoing spinal nerve. So this is the arachnoid mater, and the innermost here, which is vascular, is the pia mater. Okay, so we'll take up the meninges in the brain, which is the Dura Mater. Okay, now we'll take, this is the Dura Mater, the outermost covering. Okay, so this is the outermost covering, and what is shown here is the primary blood supply. Okay, I mentioned earlier that the primary blood supply to the meninges, the Dura Mater, is the middle meningeal artery. This is the middle meningeal artery. And this middle meningeal artery is a branch of the maxillary artery, which ascends upward, passing through foramen spinosum. And after passing through, it divides into anterior branches. These are anterior branches and posterior branch. Now, this is important for you to note this area here. Why this is okay? This is the region of the anterior inferior portion with parietal bone. This is the region of the anterior inferior portion parietal bone. Now you have a name for that. This is called terion. Terion. Okay, this is the spelling terion. The anterior inferior angle. Now, we'll try to illustrate it here. What is the location? Okay. Now, this one here is the antero inferior angle. This one here. Okay. This is the one. This corresponds to the circle here. This area here. This is called terion. So, antero inferior angle of the parietal bone. Okay, this is located actually the boundary. So this is the parietal bone, this is the greater wing sphenoid, this is the squamosal part of the temporal bone. So this is terion area. Now why is this important, this so-called terion? Because the most common cause of hemorrhage in the brain is the so-called extradural hemorrhage. Extradural hemorrhage. And the artery that is usually involved in extradural hemorrhage is the middle meningeal, the middle meningeal artery, especially the anterior branches, So this artery can rupture if there is a blow at the side or the temporal side of the head. Example are boxers, no, fighting with each other. There is a blow on the frontal temporal side can cause rupture of the middle meningeal artery. So if there is rupture of meningeal artery, being an artery, so there is a massive bleeding inside that or hemorrhage. The hemorrhage is called extradural hemorrhage. Extradural hemorrhage. And when that happens, it is important that you there are an operator or a surgeon at the site. The surgeon must immediately put an opening here in the terion. The opening we call bar hole, BUR. So they make an opening, a circular opening at the site called terion. So the terion is an important site, a landmark, or several inches above the zygomatic process. They make an opening and then make clamp with the use of forceps, clamp the bleeding, the bleeder, the anterior, usually the anterior branches of meningeal artery. Because it will not be, if the bleeding continues, the hematoma or the blood clot form can push, exert pressure into the brain, and the person will die. Okay, so this is the middle meningeal artery. Now this is the outermost covering, the Dura Mater. Okay, the Dura Mater in the brain. I will just use this one. Dito na lang muna. So this is the Dura Mater, no? The outermost covering of the brain. And this is the skull here. This is the outer table of the skull. This is the inner table of the skull. The skull is a flat bone. The cup of the calvaria is considered a flat bone. It has a outer table and it has an inner table. And you have this spongy bone, which contains hematopoietic tissue or the bone marrow tissue, and we call this diplo, D-I-P-L-O-E, diplo. Okay, and we have here the Dura Mater. Now the Dura Mater in the brain is divided into the meningeal part. This is the meningeal, and industrial part. The industrial part is actually the pericranium or periosteum, pericranium or periosteum. So this industrial and meningeal at this side, they are fused to each other. And if they have to make a sinus, the two will split. So the industrial and the meningeal will split with each other, and they will form a sinus, a venous sinus. So that's what happens here. You have here another picture. This is from the picture in Snell. You have here this illustration again. You have here the Dura Mater, and the two will split. The industrial, also called pericranium or periosteum, will split with the meningeal layer, and you have here the sinus. Okay, this is a very large sinus. We call that superior sagittal sinus. And you have here again the superior sagittal sinus receiving tributaries from the veins coming from the scalp, which we call the diploic vein. Okay, diploic vein. Now there is a clinical importance that the infection here in the scalp, massive infection in the scalp, can spread into the superior sagittal sinus via the so-called diploic vein. Okay. Now, this pericranium will stay only in the skull. What part of the Dura Mater will go below to cover the spinal cord. It is the meningeal layer. The meningeal layer of the Dura Mater will proceed downward in the foramen magnum to cover the spinal cord also. Okay. So we'll take up the important special structures derived from the Dura Mater. There are specialized structures derived from the Dura Mater. One, you have this sickle-shaped Dura Mater, which we call Fox cerebri. Okay, this is the Fox cerebri. And this is the anterior end of the Fox cerebri, which I mentioned before, will be attached here in the crista galli and frontal crest. So the anterior attachment of the Fox cerebri is into the crista galli and the frontal crest. Okay. Now the posterior end of the Fox cerebri will fuse with another Dura Mater called tentorium cerebelli. So this will unite with the so-called tentorium cerebelli. Okay, Fox cerebri. This will be lodged inside here in the. Give you another picture. Okay, here. Take note of this. Okay, here. This is the whole brain, and you have here the so-called longitudinal fissure. Longitudinal fissure. The Fox cerebri will be inserted inside, will be lodged or inserted inside the longitudinal fissure. And what is the function of this Fox cerebri? It prevents rotatory displacement of the brain. So the brain cannot move. There is no rotational movement or displacement because there is a structure that is lodged inside the longitudinal fissure. So to prevent rotatory displacement of the brain, you have the Fox cerebri. Okay. Now, you have venous sinuses. I mentioned already how the venous sinuses is formed. That is formed by the separation of the industrial layer and the meningeal layer of the Dura Mater. Okay, so what are the venous sinuses that will be formed? One, you have a very large in the superior border of the Fox cerebri. You have the so-called superior sagittal sinus. Superior sagittal sinus in the superior border. Okay, this is superior sagittal sinus, and here, this is the cup or the calvaria of the skull. You have here a colored pink. This is the sulcus. This is the sulcus of the groove. I mean the groove for the superior sagittal sinus. And just to also point out this groove here. Try to see. You can see the groove. Okay, this is the groove for the middle meningeal artery, the branches. So you have here the anterior groove for the anterior branches, and you have here the groove for the posterior branch of the middle meningeal artery. Okay. Now, at the sides also, you can find some concavities. We call this the lacuna, venous lacuna at the sides. Okay, now So, what are the tributaries of superior sagittal sinus? One, you have diploic. Number two, which is quite important, are the superior cerebral veins. Superior cerebral veins. Try to see if you have some picture. Anyway, it's not found here. But superior cerebral veins, superior cerebral veins drain into the superior sagittal sinus. Now, what is the clinical significance of this? Now, these small superior cerebral veins, they are small in size. They can be ruptured if you have a vigorous Antero displacement movement of the head during vehicular accident, or there is a violent pressure on the back of the head. These superior cerebral veins can be torn, and when that happens, there will be bleeding. But the bleeding here is not massive compared to the bleeding in the middle meningeal, because middle meningeal is a middle meningeal artery. You have an arterial blood with pressure, but we have here a small superior cerebral veins with less pressure, so the bleeding will be lesser but continuous. And when that happens, you have a condition called subdural hemorrhage. Subdural hemorrhage. Okay? So again, you have, I mentioned already, two types of hemorrhage: extradural hemorrhage, and the other one, which is lesser in not so fatal compared to middle meningeal rupture. We call it the subdural hemorrhage or hematoma. Okay, so that is the importance of the fact that the superior cerebral veins drains into the superior sagittal sinus. Another important structure found in superior sagittal sinus. Here, this one, okay. So we have here again the picture of the Dura Mater. What is shown here, you can see the middle meningeal vessels. This is the posterior, this is anterior branch. These are the main blood supply to the middle meningeal. Now this is the superior sagittal sinus. The Dura Mater has been filled of a portion, this area here. The area here of the Dura Mater has been filled off, so you can see what is inside. What you will see inside: one, you have venous lacunae. At the side here, which I mentioned before, here you have here mga granular pits or concavities, small concavities. This is venous lacunae. And what other important structure found in the venous lacunae? You have the so-called arachnoid granulations. Arachnoid granulations. Now, what are these arachnoid granulations? They are composed of arachnoid villi. And what are these arachnoid villi? This is the site where the CSF will diffuse into the venous blood, into the superior sagittal sinus. Okay? Or exit. So the site of exit in the flow of CSF is in the arachnoid granulation, found mostly along the sides of the superior sagittal sinus. Okay. You have here, I think you have another picture here. So another picture here. So this is the superior sagittal sinus, and you will see these arachnoid granulations here, composed of arachnoid villi, microscopically composed arachnoid villi, which passes through into the superior sagittal sinus. And this is the site where CSF will diffuse into the blood. So again, CSF is derived from the arterial blood. If you still remember, the CS is formed by choroid plexus, arterial capillary. So it is a dialysis from the plasma. So it comes from blood and it will return into the blood. Okay, from the arterial blood, dialysis to the arterial blood, and return to the venous blood through this so-called arachnoid villi or granulation. Now, what is the clinical importance of knowing this fact? Now, in case of inflammation, especially if you have a purulent inflammation, inflammation of the meninges is we call meningitis, right? Meningitis. If you have purulent meningitis, this past exudates can block the exit of the CSF in the arachnoid granulation, and when the exit is blocked, it will give rise to increased intracranial pressure. That explains why in meningitis, especially if you have a purulent meningitis, you can also have obstruction of the flow of CSF, leading to increased intracranial or intracerebral pressure. Okay. Now, before we proceed to the other venous sinuses, so we discussed already superior sagittal sinus. Let me finish the other coverings. So we mentioned that the outermost is dura. The next is called the arachnoid. Arachnoid, okay? This is the arachnoid mater here. You will notice that the arachnoid mater is fused into the inferior layer, inferior part of the dura. But there is a potential space. There is a potential space between the two. Okay, so that when you see okay, now I will let you see the actual appearance. This is the Dura Mater. Okay, this is the dura, outermost covering. You have here the site of the superior sagittal sinus. This is the fox cerebri. By the way, we will have a laboratory for this. No, I will be labeling the structures for you to appreciate. So wala mo ng label ngayon. So we will have a separate seizure for this. So this is the Dura Mater, the outermost. You have superior sagittal sinus. This one is the fox cerebri. Okay, see here. Fox cerebri. It's called fox because a sickle shape. And you have here the anterior end. You can see. So this is the anterior end of the fox cerebri. Okay. And you have here the posterior end that will fuse with another Dura Mater called tentorium cerebelli. So this is the junction. This area here is the junction between fox cerebri and the tentorium cerebelli. Okay. So, and you will notice this Dura Mater, you cannot appreciate the arachnoid mater because this is already dried up. So, but just remember that the arachnoid mater is attached to the inner surface of the Dura Mater, but there is a potential space between them. Okay. Below the arachnoid mater is a relatively big space, which we call this subarachnoid space. By the way, you know the Dura Mater is called dura because it is thick, it is durable. The arachnoid, why is it called arachnoid? Because if you try to see this picture, it sends off some filaments going down, filaments, which looks like the extremities of the spider. That's why it's called arachnoid from the term arachnida. If you remember your animal kingdom, phylum, arachnida means spider, and you have here which is called arachnoid because exchange of fibers, which looks like the extremities of the spine. So arachnoid mater. This space is the subarachnoid space. The subarachnoid space. Okay, if the space is large or huge, we call that cistern. If the space, subarachnoid space is huge, you have cistern, and the largest is cisterna magna. Cisterna magna. You will discuss that when you take up the flow of CSF. So this is the subarachnoid space that contains the cerebrospinal fluid. Okay, and the innermost, of course, this one here is the pia mater, which clings to the cerebral, the tissue, and even into the fissure. It follows the fissure, the pia mater. Okay, so by the way, here, let me try to see. You have this picture of the superior cerebral veins. Yeah, this is the one I mentioned before, superior cerebral veins draining into the superior sagittal sinus. If this is torn, it will give rise to a condition called subdural hemorrhage. Okay, we'll go back to the Fox cerebri. Now, the superior border, you have the superior sagittal sinus. The inferior border, this one is the inferior border. You have another sinus, smaller in size. This is called the inferior sagittal sinus. The inferior sagittal sinus. Okay? The middle cerebral veins usually drains into the inferior cerebral sinus. Okay. Now, at the junction between tentorium cerebelli, this one, and the fox cerebri, at the junction is another sinus. We call that straight sinus. Okay. Okay, the straight sinus is formed by the union of the inferior sagittal sinus, and the great cerebral vein. This great cerebral vein is the vein that drains the diencephalon. This is called the great cerebral vein of Galen. There is a name, just in case you want to know the complete name. This is called the great cerebral vein of Galen. Okay, so this is the great cerebral vein of Galen. And this vein comes from the encephalon, and it joins with the inferior sagittal sinus to form the straight sinus. So the straight sinus is located at the junction between the fox cerebri and tentorium cerebelli. Okay, and the two superior straight sinus and the superior sagittal sinus will communicate with each other in this area here, which is called confluence of venous sinuses. Here, you have this area here. Confluence of venous sinuses. Okay. This is you have here the straight sinus, and you have superior sagittal sinus. After the superior sagittal sinus, the next sinus will be the right transverse sinus and left transverse sinus. The right transverse sinus, you have here the groove. Okay, this is the groove here. This is the groove for the right transverse sinus. This is the groove of the left transverse sinus. And this is the internal occipital protuberance, which corresponds to the site of confluence of venous sinuses. Confluence of venous sinuses. But the right transverse sinus is considered as the continuation of superior. The superior sagittal sinus is continued as the right transverse, while the straight sinus is considered to continue as the left transverse. But all of them communicate with each other in the confluence of venous sinuses. Okay, now we'll take up another special structure derived from the Dura Mater, and that is the so-called tentorium cerebelli. Tentorium cerebelli. As the name implies, it's a tent. A tent forms above the cerebellum. It's called tentorium cerebelli. Here, take note of this. Just to recapitulate, this is the longitudinal fissure. What is large here is the falx cerebri. You have another fissure here, the side. We call this the transverse fissure. Okay? Transverse fissure. This transverse fissure or horizontal fissure, horizontal or transverse fissure, separates cerebrum from cerebellum. Cerebrum from cerebellum. And there is a Dura Mater that will be lodged here in the horizontal fissure, and that is called tentorium cerebelli. Tentorium cerebelli. So tentorium cerebelli separates cerebellum from cerebrum. Okay, and so this is tentorium cerebelli here. Okay. There is a gap at the middle. Probably I'll just use the actual. No, yeah. Okay. Can you see this one? This one. This is tentorium cerebelli here. This is tentorium cerebelli. Okay. And this is the one that is lodged in the horizontal fissure. This is the structure that separates cerebellum from cerebrum. Okay. And you see here, this is the falx cerebri. And the falx cerebri and the posterior end will unite with the tentorium cerebelli. And the site of union of the two, you have a sinus here, which is called the straight sinus. This is called the straight sinus here. And you have here the falx cerebri. At the lower border, you'll find another sinus here, which is called inferior sagittal sinus. Okay, and you have there is a vein here, which cannot be seen, which is called the great cerebral vein meningeal. And the two, inferior sagittal and great cerebral vein meningeal, will unite to form the straight sinus. This is the straight sinus found at the junction tentorium cerebelli and falx cerebelli. Falx cerebri. Okay, so this is tentorium cerebelli, and it has two borders. You have the fixed, this is the free, and the fixed. This is the free border. Free border here. This one is the free border, and this is the fixed border. Fixed border. Okay, and then again the tentorium cerebelli here. You have a huge nuts. We call this the tentorial nuts between the two opening. Okay, you have here the tentorial nuts. This is for the passage of the brainstem. Passage of the brainstem. in the tentorial nuts. Okay, so this is the free border, and this is the one that will be attached into the anterior clinoid process. Anterior clinoid process. Okay, the anterior clinoid process, attachment of the free border. At the sides, this is the fixed border. They are called fixed because they are attached to most of the part are attached to the bone. And what are the bone that is where they are attached? One, they are attached to the Petrus bone. So this right here will be attached to the Petrus bone, and the other parts here will be attached to the margins of the transverse sinus, or the transverse venous sinus. So this is the fixed border, and this is the free border. This is the tentorial nuts, and you have here the straight sinus, the junction. Okay. At the back here, you can see this is already the confluence of venous sinuses. Confluence of venous sinuses. Here. There is a small area of the Dura Mater. Here, you can see it here. I'll just use this one because the book is not clear. You will see a small structure that projects. And here, this is called Fox cerebelli. Fox cerebelli. So this fox, do not be confused with the fox cerebri, a big one, and a small one, fox cerebelli. This fox cerebelli is lodged between the two cerebellar hemispheres. Between the two cerebellar hemispheres, fox cerebelli. And you have a sinus also here, we call occipital sinus. Occipital sinus. Okay. So, if we are going to recapitulate the sinuses, let me enumerate again the sinuses. One. We have mentioned the superior, the inferior sagittal sinus, the confluence, the transverse, the sigmoid sinus. Now you have another sinus here. This is the what we call superior sinus. Okay, superior petrosal sinus. Let's see another one here. Superior petrosal sinus, which is found at the summit of the Petrus bone. Okay, the superior petrosal sinus drains into the sigmoid sinus. Sigmoid sinus. Okay, so another sinus which is quite important clinically is this one. Okay, you have here the superior petrosal sinus, which I mentioned before. Drains into sigmoid sinus.
Yes.
Okay. Drains into the sigmoid sinus. Now, this superior petrosal sinus drains another sinus. We call the cavernous sinus. Where can you find the cavernous sinus? The cavernous sinus is found at the body of the sphenoid bone. Still remember this area here? This is called sila torsica, sila torsica, found at the body. At the sides of the body, we call another sinus called cavernous sinus. Okay, cavernous sinus, which communicate with each other with the so-called intercavernous sinus. So there is the right cavernous sinus, this is the left cavernous sinus, and they are connected by the intercavernous sinus. This is found where? Body of the sphenoid bone. Drains into where? By the superior petrosal sinus into the sigmoid sinus. Why this is important clinically? Because it receives the vein called inferior ophthalmic vein. Found here. inferior ophthalmic vein, which communicates with the facial vein. Facial vein. Did never mind. Okay. The facial vein, the one that drains in the face, communicates with the cavernous by another vein. The name of the vein is inferior ophthalmic vein. The inferior ophthalmic vein communicates facial vein with the cavernous sinus. Okay. So, infection on the region of the face, especially if the infection occurs at the so-called dangerous triangle of the face, dangerous triangle of the face, there's a possibility of the infection to spread from the facial vein into the cavernous vein, cavernous sinus via inferior ophthalmic vein, and it will cause a dreaded complication called cavernous sinus thrombosis. Cavernous sinus thrombosis, and when that happens, usually the patient will die because it's very difficult to treat. Of course, if they have given enough antibiotics, probably the patient will survive. If you give it earlier, the dangerous triangle of the face, still remember, are the two orbits, orbital area, the nose, and the upper lip. So the orbital areas, the nose, the upper lip, that is the so-called, it forms a triangle, the so-called dangerous triangle of the infection in that area. You should treat vigorously with antibiotic because possibility for the infection to spread via the inferior ophthalmic vein into the cavernous sinus, creating, it can cause a dreaded complication called cavernous sinus thrombosis. Okay. So that is for the what else? Ano pa ba? Okay, I think I have covered everything. And anyway, I will be discussing this again during laboratory when I tie and identify structures. I will also give some explanation, short lecture. Okay, that's all for this afternoon. Thank you for listening.